Gazpacho was in for suture removal today. He had a large lump taken off of his back, and all of his stitches are non-dissolvable, so they're all going to come out today, and we're going to go through how to do it 2 different ways. So one is using the suture scissors that we have here. We basically just want to identify the suture, and you can see that there's a knot on it, and we want to cut as close to the knot as possible on just one side so that we can just pull it out. And we should have a long end, a short end, and a knot that comes out. Okay, perfect. So there it is there. We're going to continue to do that on all of them, and then we will check it after just to make sure that it looks nice and healthy. And Leah's going to do a couple of them using a suture removal blade, which may be what you will have at home to remove them. So the sutures usually come out of the skin after about 14 days of being in there. The wound should be evaluated if at all possible to make sure that removing the sutures is appropriate. A little bit of roughness and some scabbing is considered normal when you remove them, and a little bit of bleeding might be observed as well, but it should be minimal, and we shouldn't notice any large gaps when we take the sutures out. Gazpacho. So I should help by petting you, hey? Lee's gonna show you how to dull the blade. So we just want to use our blade on any sort of surface multiple times until it dulls to the point where it's cutting less. It's not a requirement to do that, but it may make you feel more comfortable with having the tool, because we really only need the tip to cut it. However, it should be safe for you to use this at home, and the way we handle it along the skin should minimize any concerns about contact with the actual blade with the skin. So it's got a little point on it. We're basically just going to fit the point underneath the same way as we did on the other side, give a little cut, and then the suture comes out. Okay. And if you give a little tug on the end of the suture, it makes it easier for you to find it as well. Sometimes there will be a little bit of crusting around the suture, and that once again is considered normal. So a little pull, and then it kind of elevates the area that you want to cut. We'll get it in. And then pull it out. Most likely, if your vet is asking you to do this at home, they have put in dissolvable sutures for a reason. We will have owners take sutures out sometimes for pets where they need to be fully sedated to come to any visit, and we think it is in their best interest to have the owners attempt it at home. And so if they are dissolvable sutures, then leaving a small amount of material in the patient is also not a concern. But once we take the knot off the top, it will remove any discomfort associated with the stitches itself. There you go. You may elect to do this with gloves on. It can be pretty challenging to grab the end of the suture with the gloves, and this cat's wound is perfectly healed, and so we have minimal concerns about any secondary infection or issues that we would cause without having gloves on for this procedure. And same with any procedure, we want to make sure that the cat is comfortable the entire time. I'm just going to finish up those, but you can see that this cat doesn't even need to be restrained. He's happy, he's just sitting on the table. There shouldn't be any significant discomfort associated with the removal. And if there is, then we should follow up and see if we need to consider an alternative. Okay, there you go. All out, looks good.